Welcome to SVG-TV News for Thursday, September 23rd, 2021. I am Rochelle Batiste with the details. 107 new COVID-19 positive cases were reported from 495 samples processed on Tuesday, September 21st, 2021, resulting in a positivity rate of 21.6%. All cases are said to be contacts of positives or persons seeking care. A news release from the National Emergency Management Organization, NEMO, said there are currently 19 patients admitted for COVID-19 at the Argyle Isolation Facility. 18 are unvaccinated and 1 partially vaccinated. The organization said a further 5 patients have been admitted to the COVID-19 ward at the Milton Cato Memorial Hospital, and all are said to be unvaccinated, with the vaccination status of 1 patient awaiting a verification. 12 new recoveries were noted over the reporting period. 697 cases are currently active and 17 persons with COVID-19 have died. 3,071 cases of COVID-19 and 2,357 recoveries have been recorded in St. Vincent and the Grenadines since March 2020. The health authorities say, in view of the confirmed presence of the Delta, Mu and Gamma variants in the community and a significant increase in the number of new infections, transmission, severe COVID-19 disease and deaths, strict enforcement and compliance with all protocols and recommendations by everyone is strongly recommended. At a news conference today, Minister of Health, Wellness and the Environment, Sinclair Jimmy Prince, reiterated the appeal for Vincentians to get vaccinated.
As I said last week, forget about the naysayers. Your safety and your health are at stake. When you're at the hospital, hooked up to a ventilator and gasping for breath, those people who persuaded you not to take the vaccine will be long gone, foraging for other excuses to fuel their own sustenance in terms of misinformation and disinformation and conspiracy theories. Be responsible. Be a good citizen. Take the vaccine, save yourself, and save your country.
Reporting on the figures of active COVID-19 cases in the country, epidemiologist Mara Bob said that the highest number of cases is in the Kingston district, followed by Calico and Mariaquaw. She, however, noted that the numbers could be higher in some districts.
And this chart shows you the number of cases over the last 7 days or so. Of active cases by health district. So the health district with the majority of active cases would be the Kingstown Health District. And then we have Caliaquaw and Mariaquaw. Okay, so this is just an idea of where the active cases are. Because sometimes when we receive a report, the address of the individual is not readily available, and so we don't know what health district to categorize them in. So over time, that number might increase slightly once we get the information.
Bob said the spike in COVID-19 cases started around September 8th, 2021, and the average positivity rate for the last week was 15.5%. She said that based on the data, the majority of COVID-19 cases are found in persons ages 34 and under.
This morning, we have 57.9% of those cases being in that age group, 34 and younger. And if we look at the last 2 lines, we can see under 10 we have 37 persons under 10 years old, and between 10 and 18 years old, 56. So we have about 31 local cases where persons were either fully vaccinated or partially vaccinated and still tested positive for COVID-19.
With an influx of COVID-19 patients requiring hospitalization, measures had to be taken by the Ministry of Health, Wellness and the Environment to make room for these patients. At today's news conference, Minister of Health Sinclair Jimmy Prince said that the Argyle Isolation Facility can no longer take any more patients as it has reached its capacity, while noting that space has been made to accommodate more patients at the Milton Cato Memorial Hospital.
The Argyle Isolation Facility has a capacity of 22, and we have already exceeded that within the last 2 weeks. Additional isolation is available at the Milton Cato Memorial Hospital, a female medical ward, which has the capacity to house 26 persons. In terms of maternity care, we have an isolation suite for positive mothers. Now, these measures that we have taken with respect to capacity would continue to have implications for our non-COVID-19 admissions and other hospital services. As such, and we have said this before, all elective surgeries, specialist outpatient clinic, and outpatient x-rays at the Milton Cato Memorial have been suspended until further notice.
Minister Prince said that patients requiring x-rays can do so at the Bookament Polyclinic, the Levi Latham Health Center, and at the Georgetown Medical Diagnostic Center. Meanwhile, the Ministry of Health is stocking up on ventilators for the upsurge in COVID-19 cases.
Vincent and the Grenadines, we have available some 26 ventilators, some of which are in storage. We also have some transport ventilators pending use, and 2 neonatal ventilators. We have put measures in place to increase our capacity in this area. Of course, ventilators will become a premium if the spike continues. We should have another 12 to 15 ventilators within the next few weeks here in St. Vincent and the Grenadines, in addition to what we have in storage.
Also, at today's news conference, the health minister made an appeal to the Vincentian public to bring in their empty oxygen cylinders in light of the growing demand. Minister Prince said that a cash incentive is being offered to those who bring in the oxygen cylinders.
We have capacity for 600 cylinders on a monthly basis. Outside of COVID-19, the hospital can use up to 400 cylinders. In August alone, 2021, we saw an increase by 100, bringing the total to 500 cylinders. Discussions are ongoing with regional and local suppliers to increase our capacity. I'm making an appeal to those with empty oxygen cylinders out there in the communities to please bring them into the Ministry of Health, and you'll be rewarded with $100 effective immediately.
The figures for unvaccinated doctors and nurses in the country are still too high. This is according to Prime Minister Dr. Ralph Gonsalves, who on the radio yesterday said while at the Milton Cato Memorial Hospital, majority of the doctors are vaccinated, there are still too many unvaccinated at other health facilities.
Community nursing, that's the nursing in the clinics, 55% are vaccinated. And in the hospital services, 42.6% are vaccinated. I say less than half. And of the 13 district medical officers, only 3 are vaccinated. Well, that's 23%. I don't understand how a doctor could be a district medical officer not taking the vaccine. I just don't understand that. I want to ask the question, how can they be relied upon to give a medical certificate to say somebody must get a health exemption?
In reference to nurses, PM Gonsalves said the figures show that while some have taken the vaccine, others are yet to do so.
Of 29 at pediatrics, 11 are vaccinated, 18 are not vaccinated. I'm talking about the staff, the nursing staff. Outpatient, 2 are vaccinated, 5 not vaccinated. The operating theater of 41, the operating theater ICU, 41 persons, 17 are vaccinated, 24 not vaccinated. Male medical, 7 vaccinated, 17 not vaccinated out of 24. Female is a little better, 22 staff members, 12 vaccinated, 10 not vaccinated. The Argyle Isolation Facility, there's 7. 6 are vaccinated, 1 not vaccinated. I don't know how somebody could work at the Argyle Isolation Facility and not vaccinated, unless there's, I don't know, I just don't know. Maybe somebody could explain that. The Modern Medical and Diagnostic Center, you have 56 staff members, 31 vaccinated, 25 unvaccinated. And look, when we're opening that, people are just rushing you down to go there, you know. Please take the vaccine now.
According to the figures given by the Prime Minister, 20 of 26 administrative staff nurses at the Milton Cato Memorial Hospital are vaccinated, and 70% at the Kingston Health District, with a high rate of vaccination in rural districts.
Calico District, which includes Belair, Calico, Enhams, and Stubbs, 46% are vaccinated. We got to do better. In Maraqua, which includes Evesham, Levi Latham Health Center, the hospital, Richland Park Health Center, Greg's Health Center, that is the Doris John Health Center, and Lomans Health Center, 51%. Cedars Health District, which includes Bayabu Health Center, Diamond Health Center, Connery Health Center, South Rivers Health Center, Park Hill Health Center, 80% vaccinated. The Georgetown District, which includes Byra, Georgetown Health Center, Overland Health Center, Sandy Bay Health Center, Oya, Fancy, 80% of the nurses.
Counselor at the Mental Health Rehabilitation Center, Elika Matthews, who is also part of the psychosocial team for the COVID-19 task force, is urging Vincentians to pay attention to their mental health as they try to cope with the changes brought about by the COVID-19 pandemic. Matthews was at the time speaking on radio yesterday about how the pandemic has led to an increase in anxiety and stress.
Sure that persons properly adjust, making sure that persons monitor themselves, because we are going and we're not paying attention to, okay, this happening, I am not doing well, I am not coping as well as I should, but because I'm constantly going, constantly moving, I'm not paying attention to the fact that my mental health is declining. So things that persons can pay attention to. How are you eating? Are you eating too little or too much? How are you sleeping? Are you not sleeping at all? Sleeping too little, sleeping too much? Things like these. Feeling sad, down, depressed, hopeless, not engaging in activities that you would have previously enjoyed. So let's say you're a person who goes out, goes to the gym, goes exercising, does gardening, different things like these, and now you're finding yourself unable to cope, unable to function, unable to do these things, especially for week on end. These are things that you pay attention to, because everybody's going to have their baseline of how they function. Everybody's going to know what they're accustomed to doing. And when you find you drop below that, and that is happening for an extended period of time, this is when you get yourself checked out.
Matthews further cautioned persons about the dangers of using negative coping mechanisms such as alcohol consumption, overeating and drug use when dealing with mental health in the pandemic.
Better way to cope, a more positive way to cope, and don't engage in those negative coping mechanisms, whether it be drinking and smoking too much or engaging in dangerous sexual behavior, things like that. Pick up the more positive ones that are going to be helpful and uplifting to you. So find something that works for you. It might be talking to a loved one, it might be exercising, it might be taking time to refocus and rebuild yourself. It has many different things that people can do in order for them to cope. I'm going to encourage persons to have a conversation, engage with other persons. Oftentimes, when things go wrong, we tend to pull back and just isolate ourselves with other people. Try not to do that. Engage with persons as possible. It could be over the phone. We have social media. It is keeping us engaged. It is keeping us connected. Be mindful, though, what you consume on social media.
The Royal St. Vincent and the Grenadines Police Force and its auxiliary forces mourning the death of a second police officer in a matter of days. Corporal of Police Keith Matthews, number 584, died at the intensive care unit at the Milton Cato Memorial Hospital on Wednesday, September 22nd, after suffering complications from an illness. Matthews was enlisted in the Royal St. Vincent and the Grenadines Police Force on October 15, 2010. A news release from the force said Matthews was a hard and dedicated worker who loyally served the organization and the people of St. Vincent and the Grenadines for the past 10 years and 11 months. At the time of his death, he was attached to the fire station at the Argyle International Airport. Matthews also worked at the police garage and the Mesopotamia police station during his brief policing career. A deputy head of the fire brigade, an officer in charge of the Argyle fire station, Assistant Superintendent of Police Ronald Benjamin, expressed deep sadness on the passing of Corporal Matthews. He lamented that Corporal Matthews always exhibited a willingness to work and he was a very reliable individual. He went on to state that the members of staff of the fire brigade are overwhelmed by the news of Matthews' passing and that he will be sadly missed. Expressing condolences to Matthews' family and friends, Commissioner of Police Colin John noted to lose one officer is extremely difficult, but to lose another one in a matter of days is very devastating. The commissioner encourages all police officers to be mindful of their health, especially in these challenging times. Matthew's death follows that of Sergeant of Police Lawrence Thomas, who died on Tuesday at his home after complaining about difficulty breathing. In a news release on Tuesday, the SVG police force said that the health authorities classified Thomas' death as COVID-19 related, noting that he tested positive for COVID-19 on September 17th and was unvaccinated. Meanwhile, in his address at the closing ceremony of the Criminal Records Office Training Course 1 yesterday afternoon at the Old Montrose Police Station, Commissioner of Police Colin John said that 2020 and 2021 have been very challenging for the Royal St. Vincent and the Grenadines Police Force, especially with the COVID-19 pandemic and the eruption of La Soufrière volcano.
We had to grapple with the COVID pandemic. We had to grapple with dengue last year, more so than this year. This year we had the La Soufrière eruption. Then we had the Elsa hurricane. Now we are in the COVID pandemic and increased cases of COVID reported incidents. But notwithstanding that, we still have our competent area, which is crime fighting, that we have to grapple with.
Commissioner John noted that the police had to be multidimensional in dealing with crimes, the deadly virus, and keeping persons safe during the eruptions of the volcano.
The fact that the police are engaged in other activities to try and commit their crime. So the police, we have to be multi-dimensional. We have seen police officers who are being affected by the COVID virus. These activities, these infections have caused us to have to work additional hours because members of our staff are either in quarantine or in hospital. So we are called upon to redouble our effort. Therefore, when we perform our duties, we have to be trained, we have to be disciplined. The challenges that were presented also presented us with opportunities.
The top cop said in light of the challenges, the RSVG police force was also presented with numerous opportunities.
It presented me with the opportunity to show my leadership skills in these trying and challenging times. Presented me with the opportunity to motivate the men and women of the Royal St. Vincent and the Grenadines Police Force. It presented us with the opportunity to surmount the several challenges that we have. It presented us with the opportunity to show the dedicated men and women that we have in this organization. And at this juncture, I just want to really thank all who are present here today and the members of the Royal St. Vincent and Grenadines Police Force as a whole for their hard work and dedication to the Royal St. Vincent and Grenadines Police Force and to the people of St. Vincent and the Grenadines.
Meanwhile, Commissioner John is encouraging all members of the RSVG police force to get vaccinated, noting that it is the best weapon to prevent serious illness and even death. He noted that though vaccination is a personal choice, he is concerned for the members as the force which recently lost one of its members to the deadly virus.
Persons took COVID vaccine and they have complications. But if you look at the statistics of the number of persons who have died as a result of COVID, millions, compared to, let's say, thousands of persons who may have had complications as a result of the vaccine. I don't think it is comparable. One member of the organization was died as a result of COVID-related complications. I understand that some of the police officers from Kelowna who were affected by the COVID, they were responding to what they thought was a sudden death, and we subsequently learned that the person died of COVID. So they may not have been as cautious as they should have been. And then when you found out, it may have been too late. You have contracted COVID.
Commissioner John said being on the front line daily, police officers must take all the precautionary measures to protect themselves and their families.
There are certain things within your control. There are certain things without your control, outside of your control. You have no control over what you would meet out there on a daily basis. You have control over how your body is prepared to meet whatever eventuality out there. As police officers, there's unimaginable things that you can meet in your duty. COVID vaccine seems to be the best weapon or the most effective weapon to prevent serious illness and death among persons. I've taken it. I'm giving you advice that I took myself, and I really would encourage persons to take the vaccine, prevent yourself, prevent your relatives from being infected as a result of your body being susceptible to this virus.
The St. Vincent and the Grenadines Pharmaceutical Association, Inc., along with the St. Vincent and the Grenadines Pharmacy Council and the Government Pharmaceutical Services, joins the world today in celebrating World Pharmacists Day under the theme, Pharmacy, Always Trusted for Your Health. World Pharmacists Day has been celebrated annually on the 25th of September since 2009, when the International Pharmaceutical Federation, the FIP, suggested its observance to coincide with the above date in the 1912 when FIP came into existence. FIP encourages the world's pharmacy professionals to advocate for their roles and contributions in improving healthcare in every corner of the world. In a public statement issued to commemorate the day, Chief Pharmacist of the Ministry of Health, Wellness and the Environment, Levi Walker, said in St. Vincent and the Grenadines, pharmacists have continued to ensure that pharmacies are stocked with adequate supplies of chronic medication for hypertension, diabetes and other chronic conditions in the face of challenging supply chain issues around the world due to the pandemic. Walker said pharmacists have also worked in shelters to bring continued pharmacy service to thousands who were displaced during the volcanic eruption. He said that drug lists were created for hypertensive, diabetic, asthmatic patients in shelters via interviews and medication reviews, and medications were delivered to the displaced populace to ensure their quality of health was preserved as much as possible given the circumstances. Walker noted that pharmacists are a high-valued group of healthcare professionals with skills that are consistently in demand worldwide.